As a healthcare professional responsible for managing a patient's medicine regime, you will no doubt have conducted numerous structured medication reviews over the years to ensure that patients are prescribed the most appropriate medications for their conditions. However, you'll also be aware that despite the best attempts to ensure medication safety, it is known that by taking certain medications, some patients can experience adverse effects on cognition. A recent study funded by the National Institute for Health Research, School of Primary Care Research and supported by NIHR ARC East Midlands found that exposure to some anticholinergic drugs is associated with an increased risk of dementia among persons aged 55 years or older. Anticholinergic drugs are a broad group of medications that block the neurotransmitter acetylcholine in the central and peripheral nervous system. Medications in this grouping include certain antihistamines, antidepressants, and drugs used for gastrointestinal and bladder conditions. This video summarises the main findings from a paper published by the research team in JAMA Internal Medicine. A link to this paper can be found below this film. The research was a nested case control study using the Q Research Primary Care Database, which contains anonymised health records of over 30 million individuals from across more than 1,500 GP practices in England. It evaluated whether exposure to anticholinergic drugs might be associated with an increased risk of developing dementia. It's already possible to quantify the level of iatrogenic harm stemming from anticholinergic activity of certain medications. Certain drugs are given anticholinergic cognitive burden, or ACB scores, which range between 0 to 3. If the sum of the scores from all of the patient's medications exceeds 3, guidance suggests that alternative medicines or other therapeutic alternatives should be considered. However, whilst anticholinergic medicines are known to have short-term side effects, such as confusion and memory loss, it has been less certain whether long-term use increases the risk of dementia. Results from this new study found that there is an association between the cumulative use of medicines with strong anticholinergic properties and the risk of developing dementia. There was nearly 50% increased risk of developing dementia if a patient had been exposed to the equivalent of 3 years daily usage of a strong anticholinergic medication. Although the study could not establish causality, the anticholinergic drugs found to be associated with an increased risk of dementia were antidepressants, bladder antimuscarinic drugs, anti-Parkinson drugs, antipsychotics, and epilepsy drugs. No significant associations were found for antihistamines, skeletal muscle relaxants, gastrointestinal antispasmodics, antiarrhythmics, or antimuscarinic bronchodilators. For those drugs that were associated with an increased risk of dementia, the greatest associations were found in patients diagnosed with the condition before the age of 80. The research also found that by avoiding prescribing some of these drugs, up to 10% of dementia cases in people aged over 55 years of age could be prevented or delayed. As such, this indicates the importance of taking action to reduce exposure to some types of anticholinergic medication in middle-aged and older people. In many instances, use of anticholinergic drugs could be avoided by prescribing alternative medicines or holistic therapies. Therefore, healthcare professionals should decide if the medication given to their patient is effective and/or necessary, and if neither, should consider reducing or stopping its use and replacing it with an alternative if needed. Likewise, even if the medication remains effective or necessary, prescribers should still consider if the benefits outweigh the risks linked to an increased likelihood of dementia and consider prescribing alternative treatments. Below this film, you'll be able to find a table outlining the anticholinergic drugs that have been linked to an increased risk of developing dementia, as well as links to the ACB calculator and the NICE stop-start tool recommended for identifying potentially inappropriate prescribing in older people. We've also included links to our patient-facing resource, which explains and raises awareness of the risks associated with some anticholinergic drugs in lay language. This can be found below this film.